Table of Contents. General Information, page 2. Contacting your transplant team, page 3. When to call the transplant team, page 4. Monitoring at home, page 6. Lab tests, page 8. Other tests, page 11. Medications, page 12. Basic diabetes training, page 41. My Healthy Vet, page 52. General activity recommendations. Activity, returning to work, sexual activity, page 53. Diet after transplant, page 56. Health maintenance. General recommendations, immunizations, bone disease, cancer screenings, dental care, page 60. Tobacco and marijuana use, page 66. Alcohol use, page 67. Pets, page 68. Review and other miscellaneous items, page 69. Quiz, page 70. Appendices. Logbooks, page 72. Hotel and food resources, page 77. Congratulations on your new kidney. Learning to care for your new kidney is important. The transplant team is here to help you. Active participation in your care during your stay in the hospital and after discharge ensure you and your kidney stay healthy. There is a lot of information to take in. This handbook is meant to help you. Keep it with you for easy reference and bring it to your clinic appointments. Your transplant team will cover the following things with you before you leave the hospital. When to call the transplant team. Monitoring your vital signs and urine output at home. Labs and other common tests. Taking medications. Safely increasing activity level. General healthcare maintenance, alcohol and tobacco use, healthy diet, and pets. Contacting your transplant team. For routine and non-urgent issues, such as appointment questions, medication refills, paperwork needs, etc., during normal business hours, Monday through Friday, 8 a.m. to 4:30 p.m., dial the main number 708-202-8387, then extension 28888. This goes directly to the transplant office. If not answered, leave a message. For urgent issues such as fever, chills, change in urination, etc., or if you need immediate assistance, dial 708-202-8387 for the operator. Ask them to page the transplant provider on call. Tell them you are a Heinz kidney transplant patient wishing to speak with your team. During off hours, holidays, and weekends, dial the main number 708-202-8387. Press 0 and ask the operator to page the transplant provider on call. Tell them you are a Heinz kidney transplant patient wishing to speak with your team. For immediate assistance during off hours, call the operator to page the transplant provider on call. Do not leave a voicemail. For a medical emergency, dial 911. For a mental health emergency, dial 988. When to call the transplant team. Call the transplant team for any of the following signs of possible rejection or infection. Weight gain of 2 pounds in a day or 4 pounds in a week. Temperature over 100.5 degrees Fahrenheit. Pain or tenderness over the kidney. Breathing problems, such as coughing up sputum, shortness of breath, problems catching your breath, pain when you breathe, problems breathing when lying flat in bed. Urinary symptoms, decreased urine output, pain, burning, or tenderness when you void, having to urinate more often, difficulty starting to urinate, cloudy or bloody urine. Incision, increased pain or tenderness, redness, swelling, drainage. Other reasons to call the transplant team: stomach problems, such as nausea, vomiting, ongoing diarrhea, or problems keeping your pills down. Pain that does not go away. Bleeding, chest discomfort, blood sugars over 400, lightheadedness or dizziness, low or high blood pressure. Any concerns you feel cannot wait until your next clinic visit. For a medical emergency, such as chest pain, shortness of breath, or passing out, call 911 immediately. Monitoring at home. Bring your logbook to every clinic visit. Check your temperature, blood pressure, weight, and urine output every day. Finding problems early allows the transplant team to treat you best. Use the logbook located at the back of this book to record your results. Bring your logbook every time you see your transplant team. Temperature. Take your temperature at least once a day, record it in the logbook. If you think you have a fever or chills, take your temperature. Call your transplant team if temperature is more than 100.5 degrees Fahrenheit. Blood pressure. Take your blood pressure twice daily at the same time. Do it before taking your blood pressure medications. Record it in the logbook. Do not take your blood pressure on the same arm as your dialysis fistula or graft. Know your blood pressure goal before leaving the hospital. Know when not to take your blood pressure medications. Too high or too low blood pressure can hurt your kidney. Call your transplant team if systolic, top number, is more than 200 or less than 100. Diastolic, bottom number, is more than 100. Weight. Weigh yourself every morning. Record it in the logbook. Weigh yourself at the same time, on the same scale, wearing similar clothes. Call your transplant team if you gain more than 2 pounds over 1 day or 4 pounds over 7 days. Urine output. When you leave the hospital, use the hat or urinal you received to measure your urine output. Record your output in the logbook. Call your transplant team with any change in amount or appearance, such as darker or bloody urine. Blood sugars. Check your blood sugars if the transplant team has told you that you need to and record them in your logbook. Call your transplant team with any low blood sugars, less than 70, or high blood sugars, more than 400. Lab tests. Blood tests. Blood draws occur twice per week for the first month after transplant. As your kidney function and drug levels stabilize, testing will be less frequent. Record your results in your logbook. Get your blood drawn in the morning, so the results are available same day. Until released to your home VA, Hines VA Medical Center will draw your labs. Once released to your home VA, arrange your lab test with your local VA transplant coordinator. If you live outside of the Chicago area, AlloSure or CareDx will contact you to schedule a special home lab draw needed a few times the first year and once a year after that. The initial contact is Sarah Salinas, 608-690-5160. Below is the estimated lab and visit schedule. This changes based on your personal needs. Timeline is subject to change. Discharge to 1 month post-transplant, twice a week. 1 to 3 months, once a week. 3 to 6 months, every 2 to 4 weeks. 6 months to 1 year, monthly. More than 1 year, every 3 months. The transplant clinic, 5th floor, will see you on the following schedule. This changes based on your medical status. Timeline is subject to change. 1 month post-transplant, weekly. 2 to 3 weeks, every 2 weeks. 3 to 6 months, monthly. 6 to 12 months, every 2 months. 1 to 2 years, every 6 months. Getting your blood test done is one of your most important responsibilities. This helps diagnose and prevent transplant rejection. Blood tests also monitor for medication side effects. It is important that you do not take some medicines prior to getting your labs drawn, because it will change the results. If you take any of these medications, wait to take it until after your labs are drawn. Follow the guidelines below. Tacrolimus, Prograf, Astigraf XL, Invarsys XR, blood draw 22 to 24 hours after last dose. Sirolimus or Rapamune, blood draw 22 to 24 hours after last dose. Everolimus, Zostres, Afinitor, Disperse, blood draw 22 to 24 hours after last dose. Cyclosporin, Sandimmune, Neoral, Gengraph, blood draw 12 hours after last dose. If your blood draw is not within the appropriate time frame, do not get it drawn. VA lab results. Based on your lab results, the transplant team will call with any changes to your medicines. If you do not receive a phone call, no changes are needed. For questions, call the office. Tests. Below are common tests that allow the transplant team to look at your kidney. Ultrasound. A technician places a small probe with gel directly on the skin over the kidney transplant. Sound waves travel from the probe through the gel into the body. The probe collects those sounds for a computer to create an image. The image shows blood flow, presence of fluid around kidney, and urinary blockage. A biopsy. A provider removes a small piece of tissue and looks at it under a microscope. Your provider will complete a biopsy in either the operating room or the radiology department. A local anesthetic numbs your skin, and the provider uses a needle to get a sample of the kidney. To prevent bleeding after the biopsy, it is common to lay flat with a sandbag or pressure applied to area to prevent bleeding. Make sure your transplant team is aware if you take any blood thinning agents. Prior to scheduling, work with your provider to develop a plan for safely holding or changing your medication. Some common blood thinning agents include aspirin, clopidogrel or Plavix, warfarin or Coumadin, ticagrelor or Brilinta, Prasugel or Effient, dipridamole or Persantine, or fish oil supplements.
Medications. Taking medicine every day for the life of the kidney will prevent rejection and loss of the kidney. While in the hospital after surgery, your transplant coordinator or pharmacist will review your medicines with you. Work with nursing staff to discuss each medicine you receive and why. Ask questions so you will know what to do when you get home. Before going home, you will receive a medication list and dosing schedule, learn what your medications look like, know how much medicine to take, learn what each medication is for, and be aware of the possible side effects. The Transplant Center manages your immunosuppression medications. Ask your primary care physician or local nephrologist to contact the Transplant Center prior to making any changes. Very important. Take your medicines at the correct time every day. The number of medicines often make it difficult to remember everything. Some options for tracking your medications include schedule taking them around meals and bedtimes, use a medication pages given to you or set up a check system of your own, use a pill box. In the first few months after a transplant, your medication doses often change. Note the following. After discharge to home, your transplant team may call to adjust your medication. Write down any changes and read them back to the caller to confirm what you heard. Add changes to your medication list in pencil to allow for future changes if needed. When you receive a new medication list, destroy the old ones. and always take your medicine as prescribed. Your pharmacist will provide information about your medicines and the most common side effects. Although you may not experience these side effects, being familiar with them is important. Call the Transplant Center to discuss any problems or questions about your medications. Over-the-counter medications, herbs, and dietary supplements may interact with your medication. Do not take any herbs or supplements without talking to your transplant team. Never take medications that boost the immune system. Bring your yellow medication card to every clinic visit. General information about your medications. Take your medicine correctly. Your health depends on it. After the transplant surgery, you will take many medicines to keep you and your transplant healthy. Some prevent rejection, immunosuppressives, also called anti-rejection medicines. Other prevent infection, anti-infectives. The rest treat other medical conditions. You must take your medicines exactly as prescribed, or they will not be effective. You will need to take some medicines for the life of your transplant. If you do not take your medicines correctly, you can get an infection, develop a rejection, or have other problems. If your medicine schedule seems too hard to follow, talk to your physician or transplant coordinator. They can help you find the easiest way to remember to take your medicines. Why do I have to take so many medicines? Anti-rejection immunosuppressant medicines. One of the most common problems after transplantation is rejection. Most patients take a combination of 2 or 3 anti-rejection medicines for the life of the transplant. Examples are listed. Tacrolimus, brand names Prograf, Invarsys, or cyclosporin, brand names Neoral, Gengraf. Belatacept, brand names Neulogix. Mycophenolic acid, brand names Cellcept, Myfortic, or azathioprine, brand name Imuran. Everolimus, brand name Zortress, and prednisone, brand name Deltazone. Anti-infective medicines. Another common problem is infection. Anti-infective drugs help prevent them. You will likely take some anti-infectives for the life of your transplant. Most patients take 3 types: an antibiotic to prevent bacterial infection, Bactrim or Dapsone, antiviral to prevent viral infection, Valsite or Zovirax, antifungal to prevent fungal infection in the mouth, Diflucan. Other medicines. Many patients take medicines to treat other health problems. Examples include stomach acid blockers, stool softener or laxatives, multivitamin, calcium, and vitamin D supplements, blood pressure, and cholesterol medicines. How can I remember to take all these medicines? Always use your yellow medication cards to set up your medicine. Do not rely on the instructions on your medicine bottles or on your memory. Keep only the current medication card. Throw away old ones. Bring your medication card with you to the hospital or clinic for every appointment. Keep your card up to date. Use a pencil to write down any changes. It will be easier to remember your medicine schedule if you know the name, purpose, dose, and appearance of each medicine you take. Know your allergies also. Consider using a pill box, alarm, or calendar to help you remember to take your medicines and stay organized. When should I take my medicines? The hospital gives medicine at standard times, such as 8 a.m., 12 noon, 4 p.m., and 8 p.m. When you go home, fit your medicine into your own schedule. Take your medicines at the same time every day. Take morning and evening doses 12 hours apart. How and where do I get my medicines? We recommend using only one pharmacy. If the pharmacist has a complete record of all your medicines, they may be able to stock all the medicines you need. They could also warn you of harmful drug interactions. Check your medicines when you receive them by looking at the pills and reading the label. If anything looks different, talk to the pharmacist. Refill early. Many pharmacies do not regularly stock some transplant medications. They may need time to order them. Always keep a 2-week supply of medicines on hand. What do I do if my medicine causes side effects? Medicines can cause side effects. Some of these side effects are minor, others are more serious. Even if you are having side effects that bother you from one or more of your drugs, do not stop taking medicines on your own. Talk to your doctor or transplant coordinator. Can I take other medicines with my transplant medicines? Other medicines can harm your transplant or react with other medicines you take. Never take any new medicine, prescription or non-prescription, without the approval of your transplant team. Do not take herbal products or health food supplements without getting approval first. If your local doctor or specialist orders a new medicine, check with the transplant office before you take it. What should I do if I miss a dose of medicine? If you remember the missed dose within a couple of hours, take it and continue your regular schedule. However, if you don't remember until it's almost time for your next dose, skip the missed dose and continue your regular schedule. Never take a double dose to make up for an earlier missed dose. If unsure of what to do or if you miss a dose, call the transplant office. Can I use generic medicines? Yes, it is okay to use generic medicines for your anti-rejection and other medicines. In general, the generic form of a medicine has the same active ingredient as the brand name version and is just as effective. The pharmacist will contact your provider if there is a concern about using a generic medicine instead of the brand name. Can I take over-the-counter, OTC, or non-prescription medicines? For occasional headaches or minor aches and pains, you can take Tylenol or its generic equivalent, acetaminophen. Do not exceed the recommended dose. Do not take aspirin, Motrin, Advil, or Aleve, or any medicines containing non-steroidal anti-inflammatories, or NSAIDs, without physician approval. Check the label, the word NSAID. Contact your transplant coordinator prior to using all other medicines. How do I store my medicine safely? Keep all medicine out of the reach of children. Store it away from bright sunlight in a cool, dry place, like a closet or bedroom. Do not store medicine in warm or humid places, such as the kitchen or bathroom. Do not store it in the refrigerator unless told to do so. Destroy any medicine you are no longer using. If you think you or someone else has taken poison or too much medicine, call the Poison Control Center at 800-222-1222. Keep this number near your phone. Anti-rejection medications or immunosuppressives. Note, you will either take tacrolimus, cyclosporin, or belatacept. Tacrolimus, brands Prograf or Envarsus. Usual duration of use, life of the transplant. Dosage forms. Prograf comes in 0.5 milligrams, 1 milligram, and 5 milligram capsules, and has generic versions. Invarsis XR comes in 0.75 milligrams, 1 milligram, and 4 milligram tablets. To make up your dose, combine strengths as needed. Do not cut them in half. Dose. Prograph patients take capsules twice a day, about 12 hours apart. Invarsis XR patients take tablets once a day in the morning. Take it at the same times every day on an empty stomach. Your dose may change based on your tacrolimus blood levels or other factors. Use a pencil to keep track of your current dose on your medicine card. Blood levels. Your tacrolimus blood level is very important in helping the team decide what dose is best for you. Always have your blood drawn before your morning dose, unless told otherwise. Bring your morning dose to the lab with you and take it immediately after your blood draw. If you take your tacrolimus by mistake before the blood draw, do not have your tacrolimus blood level checked. Call the transplant center for directions. Drug interactions. Many medicines interfere with tacrolimus. They make it less effective or increase your risk of side effects. Always check with the transplant team before starting or stopping any medicines. Avoid grapefruit, starfruit, and pomegranate. Common side effects: flushed feeling or hot flash. What to do? Contact transplant coordinator. Other side effects: hand tremor. What to do? Contact transplant coordinator. Another side effect: headache. What to do? Contact transplant coordinator. Another side effect: high blood pressure. What to do? Monitor blood pressure and call in readings as directed. Common side effects: high blood sugar. What to do? Monitor blood sugar if directed. Cyclosporin, brand names Neoral, Gengraph. Usual duration of use: life of the transplant. Dosage forms: 25 milligrams and 100 milligrams capsules or a liquid. Note: several brands of cyclosporin are on the market. Always purchase the brand you received initially. Change brands only at the direction of the transplant team. Capsule. Most patients take the capsules, which come in 25 milligrams and 100 milligram sizes. If necessary, combine the pills to make up the dose you need. Do not cut the capsules in half. Keep the capsules in their foil packet until you take them. Dose. Most patients take cyclosporin twice a day, about 12 hours apart. Take it at the same time every day. Your dose may change based on cyclosporin blood levels or other factors. Use a pencil to keep track of your current dose on your medicine card. Blood levels. Your cyclosporin blood level is very important. It helps the team decide what dose is best for you. Always have blood drawn 2 hours after your morning dose, unless told otherwise. If you are unable to get blood drawn within 2 hours, give or take 15 minutes, call your transplant coordinator. Drug interactions. Many medicines interfere with cyclosporin. They can make it less effective or increase your risk of side effects. Always check with the transplant team before starting or stopping any medicines. Avoid grapefruit, starfruit, and pomegranate. Common side effects: flushed feeling or hot flash. What to do? Contact transplant coordinator. Another side effect: hand tremor. What to do? Contact transplant coordinator. Another side effect: headache. What to do? Contact transplant coordinator. Another side effect: unwanted hair growth. What to do? Use bleach or cream hair remover. Avoid electrolysis. Common side effect: gum swelling or soreness. What to do: brush teeth twice a day with a soft brush. Belatacept, Nuolginx. Your provider may order belatacept to be taken alone or to use with tacrolimus or cyclosporin. Usual duration of use: life of the transplant. Dosage forms: belatacept is an IV infusion. It will be prepared by the infusion center or home health agency. Dose: if prescribed, you will take belatacept monthly for the life of the transplant. However, you will receive it more often early after transplant. The infusion takes about 30 minutes once started. Contact the infusion center to determine when to arrive. Warnings: belatacept may increase your risk of viral infections and a rare infection called post-transplant lymphoproliferative disorder, or PTLD. Only patients at low risk for PTLD, as determined by your lab work, will receive belatacept. Side effects to report to the infusion center or transplant coordinator: new or sudden change in thinking or memory, speech, mood or behavior, vision, balance, or strength. Side effects to report to the infusion center or transplant coordinator of the following symptoms: new fevers, night sweats, tiredness that does not go away, weight loss, or swollen glands. These signs alert the team to conduct further testing before you receive more doses. Mycophenolate mofetil, mycophenolic acid, brand names Cellcept, Myfortic. Note: your provider will give you either mycophenolic acid or azathioprine, but not both. Usual duration of use: life of the transplant. Dosage forms: mycophenolic acid comes in 2 tablet sizes, 180 milligram tablets and 360 milligram tablets. Do not break them in half. Dose: most patients take 1 to 2 pills twice daily. However, your dose may be different. Pregnancy complications: mycophenolic acid may cause harm to an unborn fetus. Women of childbearing age should use 2 forms of contraception. If considering pregnancy or if you become pregnant, contact the transplant center immediately. Drug interactions: do not take medicines containing magnesium or aluminum found in some antacids and supplements when taking mycophenolic acid. Common side effects: nausea, vomiting, or diarrhea. What to do: take with food. Azathioprine, brand name Imurin. Usual duration of use: life of the transplant. Dosage form: azathioprine comes in 50 milligrams and 75 milligram tablets. You will usually need to take more than 1 tablet at a time to make up a dose. Break tablets in half if needed. Dose: Imurin is usually taken once daily at any time of day. Drug interactions: the anti-gout medicine allopurinol, or brand name Xyloprim, and febuxostat, brand name Uloric, may cause life-threatening low blood counts when used with azathioprine. Always check with the transplant team before starting or stopping any medicines. Everolimus, brand name Zortress. Usual duration of use: life of the transplant. Dosage forms: everolimus comes in a 0.25 milligram, 0.5 milligram, and 0.75 milligram tablets. Combine tablets to make up the dose that you need. Dose: most patients take everolimus twice a day, about 12 hours apart. Take it at the same times every day. Your dose may change based on your everolimus blood level or other factors. Keep track of your current dose on your medicine card in pencil. Blood levels. Your everolimus blood level is very important. It helps your transplant team decide what dose is best for you. Always have the blood draw before your morning dose, unless instructed otherwise. Bring your morning dose to the lab with you. Take it immediately after your blood draw. Drug interactions. Many medicines interfere with everolimus. They may make it less effective or increase the risk of side effects. Always check with the transplant team before starting or stopping any medicines. Avoid grapefruit, starfruit, and pomegranate. Common side effects. Non-healing wound. What to do? Contact transplant coordinator. Another common side effect. Mouth ulcers. What to do? Apply Anbesol to sores. If no relief, contact transplant coordinator. Another side effect. Swelling. What to do? Contact transplant coordinator. Common side effect. Shortness of breath. What to do? Contact transplant coordinator. Prednisone. Note, everyone will not require prednisone after transplant. Usual duration of use. Life of the transplant. Dosage forms. Prednisone comes in 5 milligrams, 10 milligrams, and 20 milligram tablets. You may need to combine tablets or break them in half to make up the dose that you need. Dose. Take prednisone once daily in the morning. You will be on a high dose at first, but the dose will gradually decrease over time. Before you leave the hospital, you will receive a schedule that tells you when to decrease the dose. Follow the schedule as directed. Caution: never stop taking prednisone suddenly. Always follow the schedule to decrease the dose. Common side effects. Bitter taste. What to do? Take with food. Another side effect, stomach upset or heartburn. What to do? Take with food. Side effects, water retention. What to do? Avoid salty food. Common side effects, increased appetite. What to do? Eat a diet low in fat and calories. Another side effect, mood changes. What to do? Goes away with decreased dose. Another side effect, difficulty sleeping or vivid dreams. What to do? Take in the morning. Common side effect, thinning of the skin, easy bruising. What to do? Protect skin, wash cuts with soap and water. Common side effect, dry skin and hair. What to do? Use moisturizers. Common side effect, bone loss or osteoporosis. What to do? Report severe joint pain. Common side effect, blurred vision. What to do? Goes away with decreased dose. Do not change glasses for 6 months. Anti-infectives. Sulfamethoxyl trimethoprim, brand name Bactrim, or SMX-TMP. Purpose: to prevent bacterial infections. Usual duration of use: at least 6 months after transplant. Many take it for life of the transplant. Dosage form: it comes as a double strength DS or a single strength SS tablet. Break the tablet in half if needed. Dose: most patients take 1 double strength tablet once daily. Common side effects: increased risk of sunburn. What to do? Avoid prolonged sun exposure. Wear sunscreen and protective clothes. Another common side effect is rash. What to do? Notify transplant coordinator. Valganciclovir, or Valsite. Purpose: to prevent cytomegalovirus infections and herpes simplex infections. Usual duration of use: 3 to 6 months after transplant. Dosage form: it comes as a 450 milligram tablet. Do not break or cut them. Dose: most patients take 450 to 900 milligrams once daily. Common side effects: nausea and vomiting. What to do? Take with food. Acyclovir, brand name Zovirax. Purpose: to prevent herpes simplex infections, taken if not on valganciclovir. Usual duration of use: 3 months after transplant. Dosage form: Zovirax comes in 200 milligram capsules. Dose: the usual dose is 200 milligrams twice daily. Your dose may be different. Common side effects: does not usually cause side effects. Fluconazole, brand name Diflucan. Purpose: to prevent fungal infections. Usual duration of use: 1 month after transplant. Dosage form: fluconazole is available as 100 milligram, 150 milligrams, and 200 milligram tablets. Dose: most patients take 1/2 of the 200 milligram tablet daily for 1 month. Drug interactions: fluconazole may cause a small increase in prograph levels. Lab draws monitor prograph levels while you are on fluconazole. Common side effects: does not usually cause side effects. Other medicines: stomach acid blockers. Purpose: to decrease acid in the stomach, which helps prevent heartburn, stomach irritation, and ulcers. Usual duration of use: most patients take acid blockers for about 3 months after transplant. However, your doctor may prescribe a longer course of therapy. Dosage form: commonly used acid blockers include famotidine, brand name Pepcid, ranitidine, brand name Zantac, pantoprazole, brand name Protonix, or omeprazole, brand name Prilosec. However, your doctor may prescribe a different medicine. Dose: most patients take these medicines once or twice daily. Follow the doctor's orders. Stool softeners and laxatives. Many patients become constipated as a result of surgery and pain medicine. For a little while after your transplant, stool softeners and laxatives can help with constipation. Right after surgery, take your stool softener or laxative every day if needed. Regular exercise, good fluid intake, and a high fiber diet will also help prevent constipation. Recommended products. The following drugs are safe to use regularly to prevent constipation. Generic products are as good as the brand name products and are less costly. Docusate, brand name Colace, is a stool softener. Psyllium powder, Metamucil or Citracel, is a high fiber product. Mix it in a full glass of water. Always drink plenty of water during the day. If you do not, your bowel could become impacted, dry, hard stool that will not pass through the rectum. Bisacodyl, brand name Dulcolax, stimulates the bowel. Using bisacodyl occasionally to treat constipation is okay. Do not use it on a regular basis. It comes as a tablet or suppository. Senecot S, generic Docusate Senna, is a combination stool softener and laxative. It works to prevent or treat constipation. Prescriptions. Always ask for refills before you run out of medications. Ask for refills when seen in the transplant clinic. Call the transplant center during normal office hours if you are having issues with your medicines. Keep the name and phone number of your local pharmacy handy in case you need an emergency prescription called in. Bring your medication list to every clinic visit. Prescriptions. Never go to the transplant office or call the transplant pharmacist for refills. Never run out of medication before getting refills. Never wait until the weekend or until after 4 p.m. to call for refills.
Basic diabetes training. What is diabetes? Diabetes is a condition where there is too much glucose in the blood. Most of what you eat is broken down into glucose, a form of sugar which enters the blood. A hormone made by the pancreas, insulin, helps move glucose from the blood into your cells. If the insulin does not work right, your blood sugar levels will be too high. Complications of poorly controlled diabetes. Short-term complications include blurry vision, frequent urination, low energy, extreme thirst, coma, loss of consciousness, difficulty focusing, skin rashes. Long-term complications include heart problems, foot problems, kidney disease, stroke, eye problems, nerve damage, erectile dysfunction. By controlling your blood sugars, you can reduce your risk of these problems. How often should I test my blood sugar? It is important to check and record your blood sugar levels throughout the day. Talk with your doctor to determine how often you should check your blood sugar levels. See the chart below for target blood sugar ranges. When? Upon waking or before a meal, target blood sugar level ranges are 80 to 130 milligrams per deciliter. 2 hours after a meal, less than 180. Before exercising, 120 to 250. Have a small snack before exercising if your level is less than 120. After exercising, above 70. Have a snack if less than 70. Before bed, 90 to 150. A1C or glycated hemoglobin test. This simple blood test measures your average blood glucose over the last 2 to 3 months. The result is reported as a percentage. Many people with diabetes aim for an A1C of less than 7%. Talk with your doctor to establish a goal A1C level. Low blood sugar, hypoglycemia. Low blood sugar is when blood sugar levels are less than 70. Some people may have signs of low blood sugar when blood sugar levels are still above 70. Signs and symptoms when you might have low blood sugar include shaking, fast heartbeat, sweating, vision changes, nervous, grouchy, dizzy, headache. What causes it? Missed or delayed meals, eating less than usual, increased exercise, taking too much medication, drinking alcohol on an empty stomach. What can I do? 1. Check your blood sugar level. 2. If it is less than 70, have a snack to bring your blood sugar back to normal. Try eating or drinking something with 15 grams of carbohydrate. Half a cup of juice, 1 cup skim milk, 5 to 6 hard candies or 3 to 4 glucose tablets, half a can regular soda. 3. Test your blood sugar 15 minutes after eating to see if your blood sugar is back in its safe range. If it is still below 70, eat another 15 grams of carbohydrate. Wait another 15 minutes, then recheck your blood sugar again. 4. If it is still low and you continue to experience the signs and symptoms above, contact your doctor. Sick day guidelines. Being sick can affect your blood glucose levels. Below are some tricks to monitor your blood glucose levels when illness and infection attack. Take your diabetes medicine. This will help keep your blood sugars within normal ranges. Check your blood glucose levels every 4 to 6 hours. Write down all results. Try and eat your usual meals and snacks. If you are unable to eat as usual, consume 1 serving of carbohydrate, 15 grams, every 1 to 2 hours. This includes half a cup fruit juice, half a cup Jell-O, not sugar-free, 1 cup broth with 6 saltine crackers, 6 ounces ginger ale, 1 slice toast, 1 cup skim milk. Drink extra fluids. Contact your doctor or nurse if you have questions. Diabetes diet guidelines. It is important for a person with diabetes to eat 3 balanced meals with 1 to 2 snacks. This helps keep blood sugar levels stable and prevent problems. Where are carbohydrates found? Carbohydrates raise blood sugar levels, but they are an important part of a healthy diet. Our bodies need energy from carbohydrates. For a person with diabetes, having similar amounts of carbohydrates at each meal will help keep your blood sugar levels within a normal range. Below is a list of food groups that contain carbohydrates: bread, dairy, sweets and candy, juice, fruit, starchy vegetables, including beans, peas, corn, and potatoes. Foods to reduce. Limit intake of refined sweets and desserts. Limit starchy vegetables, corn, peas, dried beans, and potatoes. Reduce sodium intake. Sodium is found in processed food, fast food, lunch meats, and canned products. Reduce saturated fats. Reduce trans fats, partially hydrogenated oils, and other solid fats. Limit alcohol intake. Check with your doctor about how much you can safely drink. Foods and nutrients to increase. Fruits, up to 3 servings per day. Non-starchy vegetables, including spinach, broccoli, cucumbers, carrots. Whole grains in place of refined grains. Low-fat or fat-free dairy products. Fiber, including whole grains, nuts, beans, fruit, and vegetables. Lean protein, including eggs, poultry, beans, unsalted nuts, and seeds. Replace solid fats, including butter and margarine, with oil, such as olive and canola oil. Tips. Develop a routine. Eat meals around the same time and do not skip meals. This will help keep your blood sugar within normal ranges. Exercise. Being active has been shown to help lower blood sugar levels. Try to get 30 minutes of exercise every day. Try walking, jogging, riding your bike, or lifting weights. Portioning your food can help too. Check out some examples of portion sizes below. 1 cup baseball, half a cup tennis ball. A 1/4 cup is an egg. 1 serving of bread is a compact disc or CD. 3 ounces of meat is a deck of cards. 1 tablespoon is a tip of thumb. Friendly snacks. Snacks can be helpful for blood sugar control. It may be helpful to have a small snack before bed to prevent overnight hypoglycemia, low blood sugar. Try to choose 1 to 2 servings, 15 to 30 grams, of carbohydrates, plus a source of protein when eating a snack. See examples below. Half a cup cottage cheese with half a cup canned fruit, 1 small piece of fruit with 1 cup skim milk, 6 ounces low-fat yogurt with 1 ounce nuts, 1 cup raw veggies with 2 tablespoon low-fat dip, ants on a log, celery topped with 1 tablespoon peanut butter and 1 tablespoon raisins, 12-ounce skim latte and half cup cottage cheese, 1 ounce low-fat cheese with 10 pretzels and 1 small sliced apple. Craving fast food? Have a sweet tooth? Check out some healthy alternatives to your favorite foods. Remember, it is important to keep in mind portion sizes. Instead of cake, try sugar-free hot cocoa, sugar-free Jell-O. Instead of cookies, low-fat cookies like ginger snaps, vanilla wafers, graham crackers, or animal crackers. Instead of ice cream, try fruit with Cool Whip, no sugar added ice cream or fudgesicle. Instead of candy, try sugar-free hard candies. Instead of potato chips, try low-sodium pretzels, air-popped popcorn, baked chips, veggies, and salsa. Instead of soda, try diet soda, Crystal Light, or other sugar-free beverages. Seltzer with quarter-cup fruit juice, water with lemon. Instead of hamburger or hot dog, try grilled chicken, thin crust pizza, low-fat sub sandwich.
Put a premium on your health. My Healthy Vet, VA's online patient portal, gives you the information to understand and manage your VA care. With the free My Healthy Vet Premium account, you have secure, 24/7 access to the full suite of My Healthy Vet tools and services. You can access your VA health records, view, download, and print health information, reports, and images from your VA medical record. Send secure messages to your VA care team online. Ask your VA healthcare team or other VA staff non-urgent health questions, request referrals and medication inquiries, and send updates on your condition. Refill your VA prescriptions. Request refills of your VA prescriptions. Track your current prescriptions are shipped to you, and view your current VA prescriptions and VA prescription history. Manage your VA appointments. View, schedule, and cancel appointments and join video visits using the VA Appointments tool. Getting started with My Healthy Vet Premium. My Healthy Vet Premium accounts are free, and registering for an account takes just a few steps. If you are new to My Healthy Vet, first create an account by visiting myhealth.va.gov, selecting Register, and filling out the required fields. New and existing users can upgrade to Premium in person, online, or via video. Upgrade in person by making an appointment with your local VA's My Healthy Vet coordinator. Upgrade online by using a sign-in partner on the My Healthy Vet website. Upgrade by video appointment by contacting the My Healthy Vet coordinator at your local VA for more information. If you are a My Healthy Vet user, you may already have a premium account. Check if there's a premium label next to your name. For more information, contact the My Healthy Vet coordinator at your VA facility. Find contact information for your local VA facility at va.gov/find-locations. General activity recommendations. Activity restrictions after surgery are few. The goal is to resume your prior activity level, if not improve it. Lifting restrictions. First 6 weeks after transplant, no lifting more than 10 pounds or a gallon of milk. 6 to 12 weeks after transplant, no lifting more than 20 pounds. After 3 months, no lifting restrictions. No driving for 4 to 6 weeks after the surgery. No jogging or running on hard surfaces such as cement or asphalt for 3 months after transplant. No swimming or soaking in the tub until the removal of drains and the incision fully heals. Showers are okay and recommended. Recommend walking, biking, and swimming once cleared. General activity recommendations. Activity restrictions after surgery are few. The goal is to resume your prior activity level, if not improve it. Lifting restrictions. First 6 weeks after transplant, no lifting more than 10 pounds or a gallon of milk. 6 to 12 weeks after transplant, no lifting more than 20 pounds. After 3 months, no lifting restrictions. No driving for 4 to 6 weeks after the surgery. No jogging or running on hard surfaces such as cement or asphalt for 3 months after transplant. No swimming or soaking in the tub until the removal of drains and the incision fully heals. Showers are okay and recommended. Recommend walking, biking, and swimming once cleared. Returning to work. When you can go back to work depends on the kind of work you do. We want you to get back to work as soon as you can. Most people can go back 4 to 6 weeks after transplant. Due to COVID and the type of work, you may need to be off work for up to 3 months, even longer for more labor-intensive jobs with heavy lifting or construction. A social worker can assist with vocational rehab counseling if needed. Sexual activity. As with any major surgery, wait 6 weeks before engaging in sexual intercourse. This gives time for the incision and muscles to heal. Taking precautions against sexually transmitted infections after transplant is important. Your immune system is not as strong because of the anti-rejection medicines. This means an infection could make you very sick or lead to death. For the safety of your partner, use protection for at least the first 8 weeks due to the risk of virus transmission, hepatitis. Men. While in kidney failure and on dialysis, it is common to lose sexual desire and function. After transplant, this often improves. Some medications, like some for high blood pressure, may interfere with your sexual function. If you notice any change or having problems, reach out to your transplant center. Women. Most women are fertile after transplant. Periods, which often stop when in kidney failure and on dialysis, are likely to return 1 to 3 months after transplant. Note the following. Women can become pregnant and deliver a healthy baby after kidney transplant. If you do not want to become pregnant, use a reliable form of birth control. It is best to wait at least 2 years after transplant with good kidney function before becoming pregnant. For other reasons, pregnancy may not be recommended for you. Your provider will recommend medication changes prior to pregnancy. Discuss any plans for pregnancy with the transplant team. Women on mycophenolate, Cellcept, Myfortic, who are pregnant or considering pregnancy must consult a transplant physician. Women on these medications are at high risk for miscarriage and birth defects. If you are taking this medicine, inform your transplant center immediately if you are planning to become or are pregnant.
Diet after transplant. Your diet will change after transplant. It is based on how fast your kidneys start to work. If it is a little slow to start working, you will continue your dialysis diet. As it improves, or if your kidney is off to a fast start, these restrictions will change. Drink plenty of water, at least 3 liters per day. 1 liter is equal to about 32 ounces, which is equivalent to 6 standard 16.9 ounce water bottles, which equals 3 liters. Safe food handling is very important because your medicines used to prevent rejection suppress your immune system. Always wash your hands frequently in warm, soapy water for at least 20 seconds after using the bathroom and before handling your food. Wash all fruits and vegetables under running water. Separate raw produce from uncooked meats. Use separate cutting boards and clean utensils. Sanitize sinks and chopping boards with half a teaspoon of bleach and 2 cups of water. Use a meat thermometer. Cook sausage and chicken to at least 165 degrees. When dining out, ask restaurants to cook solid meats to medium and ground meats to medium well. Chill foods properly at 40 degrees or less within 2 hours of cooking or purchasing. Thaw frozen meat in the refrigerator. Avoid thawing or marinating meat at room temperature. Do not share utensils or food. Do not eat the following raw: eggs, including cookie dough, cake batter, eggnog; unpasteurized dairy products, including milk; sprouts such as alfalfa and clover sprouts; seafood, including sushi and oysters. After transplant, we will track how your new kidney is working. Based on your labs, your transplant team will talk to you about suggested changes in your diet. In the first 1 to 2 months after surgery, you need an increased amount of protein. After your incision heals, your protein needs will go down. Ask your dietitian how much protein you need. Sources of protein include meats, fish, poultry, dairy products, eggs, nuts, dried beans, lentils, peas, soybeans, soy milk, tofu. Sources of phosphorus: dairy products, cottage cheese, milk, yogurt, cheese, nuts and nut butters, dried beans, lentils, peas, seeds, whole grain products, bran cereals. Sources of potassium: dark green leafy vegetables, tomatoes, oranges, milk, bananas, dried beans, lentils, peas, potatoes. Be aware, foods such as processed meats, packaged deli meats, sweets, snacks, and beverages can be very high in potassium and/or phosphorus. It is best to control your intake of these foods first. Sources of magnesium: nuts, seeds, including pumpkin seeds, Brazil nuts, almonds, cashews, etc., whole grains, bran cereals, greens, including spinach and Swiss chard. Adequate calcium intake is important to protect your bones. Sources of calcium, including dairy products, greens, including spinach and Swiss chard. After transplant, prescribed medications may change appetite, cholesterol levels, blood sugar, blood pressure, and alter magnesium levels. Eating a heart-healthy diet can help control these factors. Follow the healthy plate method to keep portions well balanced. A quarter plate starch, a quarter plate protein, half plate non-starchy vegetables, 1 serving of dairy, and fruit with each meal. Choose plant-based protein sources often, such as lentils, beans, and nuts. Purchase fresh fruits and vegetables. Select fresh meats, fish, and poultry without added seasoning and breading. Choose fresh food choices and cook from scratch for healthy, low-sodium menu options. Limit sodium intake to 2,300 milligrams per day. Limit the following: foods high in saturated fat, such as fried foods, high-fat cuts of meat, butter, cream, etc., processed food choices such as deli meats, frozen entrees, restaurant meals, and fast food meals, sugar intake by limiting portion sizes of sweets and sugary beverages. Avoid grapefruit, pomegranate, and Seville oranges due to possible interactions with medications.
Health maintenance. In addition to a happy, healthy, functioning kidney, we want a happy, healthy, functioning you. We suggest regular health maintenance. Exercise regularly, at least 3 days a week, including cardio and weights. Eat a well-balanced diet to help maintain a healthy weight, control your blood pressure, monitor and treat high cholesterol. Do not smoke, use tobacco, or use other vaping products. Complete your annual visit with your primary care provider. Maintain good hand hygiene. Post-transplant diabetes. Post-transplant diabetes can occur after transplant due to the medications used. A healthy diet and exercise can help manage it. If needed, your provider will prescribe medications such as insulin. Immunizations. Vaccines should have been up to date prior to transplant. After transplant, do not get live virus vaccines, as they can cause an active infection in your body. Live virus vaccines include smallpox, measles, mumps, rubella, oral polio, intranasal flu vaccine, chickenpox. Dead vaccines are okay to get. They include RSV, diphtheria, tetanus, booster every 10 years, TB skin test, flu shot, Pneumovax, RSV, diphtheria, tetanus, booster every 10 years, TB skin test, flu shot, Pneumovax, and COVID vaccine. An annual flu shot is recommended starting 3 months after transplant. COVID vaccination schedule is changing. Monitor the news for new guidelines on COVID boosters for the immunocompromised. Ask your transplant team when you are due for the next booster. A Pneumovax booster, if up to date prior to transplant, is recommended 5 years post-transplant. Travel. Before traveling out of the country, consult with a travel clinic about what you need. Make sure to remind them as a transplant patient you should not receive any live virus vaccines. For questions, contact the transplant center. Respiratory illnesses, including but not limited to COVID-19, RSV, and flu. COVID-19 is ever-changing and can be deadly to transplant patients due to a suppressed immune system. In general, avoid crowds, family gatherings, funerals, and indoor dining. Consult with your transplant team prior to any events, as suggestions may change based on your health status. Wear a face mask anytime you leave your home. Bone disease. Transplant patients may suffer from bone disease. A bone density study should be done at least every other year. Talk with your primary care provider about scheduling this and what you can do to prevent and treat bone disease. Routine cancer surveillance. The Edward Hines VA follows the American Cancer Society guidelines for cancer screening. Women. Pelvic exam with pap smear annually. Frequency may change based on personal history and age. Talk with your provider. Mammogram. Average risk. No personal history of breast cancer or genetic mutation known to increase the risk of breast cancer, such as the BRCA gene. No chest radiation therapy before the age of 30. Ages 40 to 44 have the option to start screening yearly. Ages 45 to 54, yearly. Ages 55 and older can switch to every other year or choose to continue yearly screening. Screening should continue if in good health and expected to live at least 10 or more years. High risk. Breast MRI and mammogram every year starting at age 30. You are high risk if you have a lifetime risk of breast cancer of 20 to 25% or greater, based mainly on family history according to risk assessment tools. Have a known BRCA1 or BRCA2 gene mutation. Have a parent, sibling, or child with the BRCA1 or BRCA2 gene mutation and have not had genetic testing. Had radiation therapy to the chest between ages 10 and 30. Have Lee-Fraumeni, Cowden, or Banyanyan-Riley Ruvalcab's syndrome, or parent, sibling, or child with these syndromes. Men. PSA, prostate-specific antigen. Age 45 for high risk. African American men and men who have a first-degree relative diagnosed with prostate cancer at or before the age of 65. Age 40 for highest risk, those with more than one first-degree relative, parent, sibling, or child, who had prostate cancer at any age. Everyone. Colon cancer screening. Average risk. Start regular screening at age 45 with either stool test or a colonoscopy. The results will determine frequency of future tests. You are average risk if you have no history of colorectal cancer or certain types of polyps, no family history of colorectal cancer, no personal history of inflammatory bowel disease, no confirmed or suspected hereditary colorectal syndrome, no personal history of radiation to the abdomen or pelvic area. High risk. No definitive guidelines, but frequent and early testing is necessary. Discuss plan with your provider. You are high risk if you have strong personal or family history of colorectal cancer, personal history of inflammatory bowel disease, known history of hereditary colorectal cancer syndromes, radiation to the abdomen or pelvic area. Skin cancer. Avoid sun exposure and use a sunblock with SPF 30 or more. Don't forget to protect your lips from the sun. Use hats and clothing with UPF if available. For any new moles or any changes to current moles, notify your primary care provider. If diagnosed with any type of cancer, notify the transplant center immediately. Your provider will likely change your anti-rejection medicines. Dental care. Routine dental care is important after transplant. Infections could become very serious because of the medications you are on to prevent rejection of your kidney. After transplant, delay any routine dental cleaning for 3 months and anything more invasive, for example, crowns, fillings, tooth removal, for 6 months. You may need antibiotics for anything beyond cleaning. Inform your dentist that you have had a kidney transplant and that you are taking immunosuppressant medications. If there are any questions, please have the dentist contact the transplant center. Tobacco and marijuana use. Use of tobacco and other vaping products cause the side effects listed below. Chewing tobacco causes gum disease, tooth decay and loss, cancers of the esophagus, mouth, pancreas, and kidney, increased risk of death from stroke and heart disease, increased risk of premature delivery and stillbirths if used during pregnancy. Smoking causes increased general surgical risks, impaired wound healing, lung disease, heart disease, diabetes, and stroke, vision problems, cancers of nearly every organ system. Smoking marijuana can cause fatal brain and lung infections. Vaping, partially dependent on what substance that is being consumed but can lead to all of the above, can cause devastating acute lung disease. If you need help quitting, talk to your primary care provider. Alcohol use. Alcohol in and of itself is not harmful to the kidney. However, avoid excessive use of alcohol. Alcohol use can lead to dehydration, poor decision-making, and missed medication doses, all of which could be harmful to the kidney. Long-term and excessive alcohol use can lead to high blood pressure, various cancers, and liver failure. If drinking, stay hydrated. For every alcoholic drink, drink an extra glass of water. The CDC recommends no more than 1 drink a day for women and 2 drinks for men. 1 drink equals 12 ounces of 5% beer, or 8 ounces of 7% malt liquor, or 5 ounces of 12% wine, or 1.5 ounces 80 proof distilled spirits or liquor. Pets. Many pets can remain in the household with proper precautions. Pets must be up to date with vaccinations, worm treatments, and checkups. Provide flea and tick prevention. Transplant patients should avoid cleaning up or coming into contact with animal feces. Wash your hands with soap and water after handling or cleaning up after your animals. Transplant patients should not have the following pets: reptiles, such as snakes, lizards, turtles. They can carry diseases that may be deadly, including salmonella. Birds can also carry diseases like psittacosis. This includes chickens or pigeons in coops. Rodents, domestic and wild, may carry hantavirus and plague. Ticks can transmit Rocky Mountain spotted fever and Lyme disease. Take proper precautions if in the outdoors. Avoid contact with wild animals. Review and other miscellaneous items. Stay hydrated with 3 liters of water every day. Some coffee and tea is okay, but be careful as these drinks can be dehydrating. Avoid NSAIDs, for example, Advil, Motrin, ibuprofen, Aleve, naproxen. Use Tylenol for pain. Avoid studies using IV contrast. When absolutely needed, your provider should consult with the transplant team. Request refills early. Mailed medicine can take up to 2 weeks to arrive. Take your medicines as directed. Hand washing is very important. Wear gloves if gardening. Avoid crowds, indoor gatherings, and family get-togethers until the transplant team says that it is okay. The risk of COVID is very concerning for your health. Wear a mask if anyone not living in your household or if someone in household is ill. Always keep your team updated on any changes in your health. Always bring your yellow medication card and logbook with you to clinic appointments. You have a stent in your bladder to protect the new connections. This is taken out in about 4 weeks.
Hotel information for out-of-town veterans and support person. You will be staying at Staybridge Suites, Oakbrook, which is located in 200 Royce Boulevard in Oakbrook Terrace, Illinois, 60181. Phone number is 630-953-9393. The suite can come with 2 beds, but it would have to be requested. However, for rooms with 2 beds, there is no guarantee that it will be on the first floor, but there is an elevator in the building. There is a full kitchen, stovetop, refrigerator, microwave, dishwasher, utensils, cookware, but no oven. Complimentary hot breakfast is served every morning, and there is a free laundry at the hotel. Edward Hines Jr. VA Hospital also has Veterans Food Pantry. The Greater Chicago Food Depository, in partnership with Hines VA Hospital and AmeriCorps, is providing food for those who served. It is on-site food pantry that provides nutritious and healthy food for veterans. It is for all veterans, and you will be asked to provide identification. It is on every Thursday from 10 a.m. to 12 p.m. It is at Hines VA Hospital in Building 1, D lobby. Other food options to consider is delivery services such as Amazon Groceries, Walmart, Jewel. You can also take a ride share or cab to any local store, or you can ask the hotel front desk staff for any other suggestions. The other option is My Pantry Express. It allows veterans to online shop for groceries. There is no residency or income restrictions. It looks like there is a pickup location in Westmont, which is few miles from Oakbrook. 24/7 confidential crisis support for veterans and their loved ones. If you are a veteran in crisis or concerned about one, reach caring, trained responders 24 hours a day, 7 days a week. When you call the Veterans Crisis Line, here is what to expect. A qualified responder will answer your call, ready to listen and help. The responder will ask a few questions, such as whether you or the veteran you're concerned about may be in immediate danger or at risk for suicide. The conversation is free and confidential, and you decide how much information to share. Support doesn't end with your conversation. Our responders can connect you with the resources you need. You don't have to be enrolled in VA benefits or healthcare to connect. Dial 988, then press 1. You can also chat online at veteranscrisisline.net/chat, or you can also text at 838-255. The Department of Veterans Affairs Caregiver Support Line is a toll-free number for caregivers, family members, friends, veterans, and community partners to contact for information related to caregiving and available supports and services. Our dedicated CSL team provides information on caregiver support services, counseling, educational services, and referrals to local caregiver support program staff at VA medical centers. VA caregiver support line number is 1-855-260-3274. Operating hours are Monday through Friday, 8 a.m. to 10 p.m. Eastern Time. Saturdays, 8 a.m. to 5 p.m. Eastern Time.